Okay, hello everyone. Hey, welcome to our almost weekly talk about cardiac conditions, COVID, etc. And I appreciate everyone sending us some messages and logging on here. I'm Dr. Evan Levine, and I'm the director of the Doc's Cardiac and Hypertension program here. And these are Heart Talks with Dr. Levine. Today, I was going to just discuss one topic, but there was some news about carotid testing, and I'll bring that up as well. Today's topic is about pre-op cardiac stress testing, and I think that's a rather important topic. And what what is the story behind that? And doctors fear perhaps that if you're undergoing a surgical procedure, is there a risk of having a heart attack or an arrhythmia or heart failure because of the stress of that surgical procedure? And many people are worried about that. And it's important to know, number one surgery is a lot different often than another surgery. So although we use the word surgery, you're basically at a very low risk to just start off, regardless of your history. If you're having something like an endoscopic procedure or cataract surgery, superficial procedure, some sort of ambulatory surgery, except with a joint replacement, dental surgery, a TURP, minor urologic procedures, even a carotid endarterectomy, if you're asymptomatic, is considered a low risk. We're going to get to that because this is going to tie into the second topic of carotid ultrasound. So, years ago, practicing at Montefiore, and patients would come for a pre-op, and a lot of cardiologists still see this for cataract surgery. And I would say, they asked me if they needed a stress test, and I said, well, crossing the street right now probably put you at greater risk than having cataract surgery. The risk of you having a heart attack with such a minimal procedure is not significant enough to warrant a stress test. Too many people basically get stress tests before an operation. That's the way our system works sometimes. It's a capitalist system. More tests create more income. And so lots of people don't need stress tests. Now, I'm not saying all people don't need stress tests. Many of the patients eventually will require a stress test, but not for cataract surgery. The simple thing to keep in mind is most people who need a stress test before an operation would have needed a stress test anyway. Okay? So patients with an intermediate risk of having coronary disease, oh doc, 45 years of age and I get chest discomfort sometimes when I walk and sometimes when I don't. And the doctor's just not too sure if you have coronary disease or not, that type of thing. Those people need stress tests. Now, we spoke about low-risk procedures. There are high-risk procedures, okay? So cataract surgery is a low-risk procedure. Colonoscopy is a low-risk procedure. And then there are high-risk procedures where there is a risk of having a heart attack, a substantial one, maybe as high as 5% in all comers. People who need vascular surgery or thoracic surgery or transplant surgery, these are people that are pretty high risk. And those are the folks with that really major surgery that we need to consider. And I say consider because not all of them should go for stress tests. And that's another problem. The answer is not go for a stress test just because you're at a high risk. You're having a high risk procedure. Doesn't mean you're at high risk. Okay, so if we take those high risk surgical procedures, or your doctor should look elsewhere. and look at the patient. What is the risk of the patient? Does the patient have coronary disease or not? Do they have kidney failure or abnormal kidneys? Do they have diabetes? Have they had a stroke or a TIA, a transient ischemic attack, which is the patient was almost going to have a stroke and it went away? And then your doctor should consider now these risk factors and make a decision. So let's say, oh, I'm going for a procedure. It's a pretty high risk procedure. I've got some risk factors. Do I need a stress test? Well, Dr. Levine is going to say yes, but not necessarily all the time. Okay, we just continue on this path of really looking at the patient, and that's important. A good physician looks at the patient and just doesn't say you need a stress test. Okay, so you're going for a high risk procedure, you got some risk factors. What's next? Well, the next thing is look at the patient. Is the patient able to, or do they do a lot of exercise or their daily activities? And we want to know how many metabolic equivalents they can do. Mets, not the New York Mets, but Mets. And patient A, let's say, is a marathon runner. They have some risk factors. They're going for a high-risk procedure, but they just ran a 26-mile marathon. They don't need a stress test. Or patient A plays singles doubles every day. Or patient A just fertilized his 4 acres of lawn. Or patient A, split wood for a day. Okay? Or patient A just does any type of heavy work and never had symptoms. Okay, you really should not have a stress test, even if you're going for a relatively high-risk procedure and you have risk factors. Patient B is sedentary and really hardly walks. Maybe to the supermarket, maybe a block or two, they take the car, maybe they get a little winded. Now you've got your patient. Patient's going for a high-risk test. Click. Patient has significant risk factors for coronary disease. Check. Patient leads a sedentary lifestyle, doesn't exercise, really doesn't do much work around the house. Maybe they can't walk a couple of flights of stairs. Check. That's the patient that needs a pre-op stress test. That's the patient we're concerned about that may be at significant risk during the surgery. And remember, when you do a stress test, you have to realize that you have to do something about the results. I'll give you one example where the patient should not have had a stress test. Patient had asymptomatic carotid disease, or even symptomatic carotid disease, but had no symptoms, exercised well, had a stress test. It was equivocal, mildly abnormal, had the surgery. Didn't even have this, nobody even intervened afterwards. And then after the fact, was called back in to have an angiogram based upon a stress test that probably shouldn't have had. Patient had some kidney disease and had a stent placed. He had no symptoms, so the stent is not going to help them. And then the patient's kidney function got worse from the contrast. So before going for a study, think about the consequences of having that study. The take-home message is not everyone who goes for a surgical procedure needs a stress test. Remember, 1, what kind of surgery are you having? 2, what are your risk factors to have cardiac disease? 3, what type of lifestyle do you lead? Are you able to exercise long distances versus having a sedentary lifestyle? There's a lot here to digest, but what I'm saying is ask questions of your physician before agreeing with the stress test and ask them what the indications of the test is. They should be able to answer that question. Part two, because we mentioned carotid endarterectomy. Part two today is discussing another test called a carotid ultrasound or carotid duplex. Now, a lot of people say, "Ooh, I got a carotid study and it showed nothing, I'm happy," or a small blockage, or maybe even there was somewhat of a somewhat significant blockage. Well, the U.S. Preventive Task Force, this is an independent group of doctors, independent, okay? No one's telling them what to do. They're the top physicians. They volunteer to be on this panel, and they look at things objectively, not subjectively, objectively, based upon real data. Okay, so no one's interfering with them, pharma or anything else. And they announced again that carotid duplexes, those ultrasounds that people get, are not NOT indicated for asymptomatic patients. So if you had a stroke, of course you need a carotid duplex. If you had a transient ischemic attack, TIA, what is that? Someone's arm was weak and it got better right away. Or someone had difficulty speaking and then it got better. Or someone lost their vision in their eye and it got better. Transient, okay, temporary, ischemic attack. Those folks need carotid duplexes. But duplexes on an asymptomatic person, according to this preventive task force, is unnecessary. Even if they have some disease, because let me just say, you can have somewhat of a blockage in your carotid artery, even your coronary artery. But imagine it's a perfectly smooth surface. Let's take a concrete slab, right? Asymptomatic people, concrete slab, little chips aren't going to break off. People who are symptomatic, who have TAs or stroke, let's say that concrete slab becomes crumbled a little bit. You see what I'm saying? That's what happens. So there's a difference between someone with a 70% blockage and a stable lesion than a 70% blockage and an unstable lesion. You do all these carotid duplexes, what are you going to do with the results? There's potential for harm. You're going to send someone for surgery, a carotid endarterectomy with its other risks. And that's why this independent panel, the U.S. Preventive Task Force, announced in February that they no longer do not recommend carotid duplex exams on asymptomatic individuals. And that's the key word, asymptomatic. So today we touched on two things. We touched on stress tests or pre-op stress tests, right? And we touched on another study, carotid duplexes. These things are indicated for people that need it, but not indicated for patients that do not require intervention with these things. If you have any further questions, please don't hesitate to leave us a message on this Facebook post. I promise to answer them back in a timely manner. And thanks again for everybody for joining us, and have a great day.